Thank you, Madam Speaker. Madam Speaker, when times get tough, we are often asked or forced to sacrifice. And we know that it's usually women who end up making the biggest sacrifices. People gave this government the benefit of the doubt when they said they'd fix health care, but people aren't seeing the progress they were promised. Today, we heard the heartbreaking story of Cassidy Horn, who lost her baby after multiple delays getting the ultrasound care she desperately needed. No one should have to go through this horrific experience. What is this government doing to ensure that no other mother has to go through Cassidy's heartbreak?
I recognize the Honourable Minister of Health and Wellness.
Thank you. Thank you, Madam Speaker. And I did hear about this tragic loss yesterday, and I want to extend my deepest sympathy to parents and grandparents and the broader family. So I cannot speak directly about individual cases, but I can assure the family that there will be an extensive review of the situation to understand what happened through the quality review process. And so I have to trust that process, and we will continue to monitor the situation. Thank you.
I recognize the Honourable Leader of the Official Opposition.
Thank you, Madam Speaker. Madam Speaker, women and gender-diverse Nova Scotians are not getting the health care they deserve. Only 7% of the health research in Canada is focused on women. The IWK Foundation is leading the way in advocating for change at the national and provincial level, and this government's response, they are cutting 20% from a grant to the IWK, limiting research on women's health in this province. And this is shameful.
Shameful. Shame.
When women's health gets such little support, how can the minister justify a cut to this important research?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Madam Speaker, and I thank the member for the question. So we are committed to improving health for all people in Nova Scotia, but we do know that there is a particular focus on women's health in our province. As you know, we've recently announced the Menopause Centre of Excellence. We're working to support women who are in midlife and beyond. There is work that's happening across prevention, early diagnosis and screening. We're looking at specialty clinics as well. We've increased the number of gynecological services across the province. There are a number of partners that we have who are doing research, who are informing practice experts in the field. We are committed. We are working with the IWK. We have extensively reviewed the survey, and so this will take some time and it will take consultation, but we are committed to women's health in this province.
Before I recognize the Honourable Leader of the Opposition, I ask that people speak to me, to whomever they're asking the questions of, and not directly to the person. And just like if you're responding to a question, respond to me instead of the person that you're asking for. I recognize the Honourable Leader of the Official Opposition.
Thank you, Madam Speaker. With respect, that Menopause Centre of Excellence was promised years ago, and announcements aren't care. The research funding for the IWK was cut by 20%. Women are left waiting. They're waiting too long for prenatal care, ultrasounds. There aren't enough midwives to meet the need. They're waiting months or years for endometriosis treatment, menopause support, mental health services, waiting for better cancer screenings, waiting for access to free birth control like their peers across the country. Women are paying for this government's delay with their health, Madam Speaker. If the government takes these concerns seriously, why are we seeing so little progress?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Madam Speaker. So, as I've said before, we do take this issue of women's health very seriously. The Menopause Centre of Excellence was promised a year ago, and we have worked extensively with the Menopause Society of Nova Scotia, as well as experts in the field. This Centre of Excellence will include not only clinical care, but it will also incorporate education for individuals as well as clinicians, and it will also involve research. These things need to build. We are committed to that. There have been a number of improvements in terms of the ability to access gynecological care. The teams that we've invested in from a primary care perspective will also assist women in getting the care they need in community in a more timely fashion. There are a number of initiatives that are underway, and I look forward to having a more fulsome conversation and estimates. Thank you.